Francis, hello. Should we start or wait for people to join? Yeah, I can see very few people have joined. Now, morning, ladies and gentlemen. Hello, good morning, ladies and gentlemen. Can you hear me?
Yes, I can. Good morning.
Morning, how are you?
Good morning.
Good morning, Madam.
Morning, how are you?
I can hear you from here in the
Okay, then that's fine.
zone.
I think I would just want to call this webinar to start. We want to start the webinar presentation. And I think we've got at least a big number of people have joined in. I would start by introducing that we have been having these webinars, and this is going to be the 14th webinar. We started in 2022. We've been carrying out all these webinars as a source of information sharing from our partners, from our stakeholders on issues of water and environment and climate change. And with these webinars so far, we got from different partners. We've got from academia, we've got from civil society, we've got from practice that people are doing the work within the water and environment sector. And we'll continue to have these webinars at least once in a month. But in case the frequency increases in case we get more researchers wanting to present webinars, and through the Water Resources Institute, we shall increase the frequency more, maybe twice a month or 3 times a month. But currently, we are holding them once a month. Otherwise, I want to wish you a Happy New Year. And this is our first webinar in 2024. We have a presenter from WASNET. WASNET is the major, like a CSO or a flagship of all the CSOs. An umbrella for all the CSOs that deal with water and sanitation. Whereas Environmental Art is an umbrella for the CSOs that deal with the environment and natural resources. On this note, I want to welcome I want to welcome the presenter tonight that is going to be coming from WASNET. His name's, if you can screen his name, Francis. Hello, yes, Francis. Is Francis online? Okay, Francis is sharing the screen. And we're saying this presenter is called James Cleato Mumbele, who is a policy He's a policy and advocacy coordinator under UWASNET. As I earlier said, the UWASNET is an umbrella for all CSOs, that all NGOs that deal with water and sanitation, or in short, WASH. activities. The webinar today is going to be focusing on social accountability using the WASH Scorecard in Uganda. On this note, I want to welcome James to take over and take us through this. At the end of the day, at the end of the presentation, we shall have discussions, we shall have recap, we shall have people's asking questions, and the presenter will be able to answer some of these questions. Since it is under UWASNET, I will give over the modulation to UWASNET. James, thank you. Over to UWASNET to take over the modulation. We shall come back at the end of the presentation as Water Resources Institute, and we conclude on today's webinar. Thank you.
Well, thank you very much, Gwendolyn, and thank you, Francis, the entire team at the Uganda Water Resources Institute in Entebbe. Thank you for the opportunity given to us again here at UWASNET. Like it's been said, my name is James Kleto Mumbere. I am the Policy and Advocacy Coordinator at UWASNET, and I would like to, as I will be sharing my screen here, I'll be taking you through what UWASNET is. Well, just like I've been telling you, that UWASNET, and picking it up from Gwendolyn, maybe I may put my video off, is a membership network founded in the year 2000 by the different, sector development partners, as well as the umbrella, as well as government of Uganda, as an umbrella organization for all civil society organizations. So UWASNET's vision, unfortunately, I forgot to put it here, is to ensure that all people have access to improved and sustainable water resources, sanitation and hygiene programs, and of course, to achieve that vision, there is a mission which is to strengthen coordination and collaboration of CSOs and other stakeholders in the water resources, sanitation and hygiene environment programs in Uganda. So a snapshot of what the UWASNET governance structure looks like is purely that. At the helm, we have the General Assembly, and this brings together all the civil society organizations and private sector players who have subscribed to UWASNET or to be members of UWASNET. And apparently we are talking about the sector is having over 250, civil society organizations, but we find out of all those, only about 156 have subscribed with UWASNET. So we still have some other CSOs that haven't yet subscribed with us. At the same time, after the General Assembly, we have the Board of Directors. You can see that picture of the Board of Directors from 2022 to 2024 with those organizations, because here it is not an individual merit, it is organizational, the members. So we have the board composed of IRC, Simavi, Life Water, Water Mission, WAVE, Habitat for Humanity, AMREF, UMDA, CD, Katosi, and Caritas, Fort Porto, which is sometimes called as HEWASA. And then we have UWASNET, part of the board as secretary to the board. And then we have the government of Uganda on this board, represented by Minister of Water and Environment, basically as ex officials. That is the composition of the UWASNET board of directors. And then we have a secretariat where I sit with a very lean staffing. We actually not more than 15 doing the work that we are going to be talking about today. We have other two or probably three coordinating structures. The first on my left is the regional coordination structures. Now, To kind of cascade or devolve the work that we do, we chose to, uptake the former technical support units, the TSUs, and chose to maintain them as regional coordination structures. So we have Mid Central, Western, Rwenzori, Central, West-Nile, as you may see them over there. And then we have the thematic working groups now. After all the members have subscribed to UWASNET, we believe that each member have their specialty or have their niche business somehow, somewhere. They have their interests somewhere as they join the big network. So we have 7 different thematic working groups. One of them is the women, children, and other vulnerable groups. We have CSOs who come in the network, basically to discuss issues around women, children, other vulnerable groups, how gender and social inclusion, how are the women having access to water? How are they? Is the water affordable for them? How about the children? How about the youth? How about the other vulnerable groups, the persons with disabilities? We have a thematic working group that deals with sanitation and hygiene promotion. Sanitation and hygiene in institutions like schools, healthcare facilities, but also in communities. We have a thematic working group that deals with issues around good governance for WASH. Good governance for WASH, dealing with policies, laws, analysis and of budgets, and trying to disseminate all the government, operating probably guidelines or frameworks to reach out to the last person there, the grassroots. So we have organizations that subscribe to the network, but their interest is basically around that area. We have another thematic working group called the WASH Technologies. WASH is a very scientific field, so it deals with technologies, and these are innovations that come in every now and then. When we're talking about, boreholes, now we're talking about motorized, solar systems. So there must be someone discussing issues around there. How are they coming up with these technologies? How are they certified? But even after they've come up with technologies, how are they being promoted across? What are those salient issues affecting them? Issues around WASH equipment, taxation, issues around the counterfeit products on the market. These are the organizations that help us, think through around the WASH technologies in the sector. We have a thematic working group that brings together CSOs that work on issues of integrated water resources management and climate change, all issues around the environment. And maybe one thing I never mentioned, that all these have governance structures. They have people leading them. And then we have a thematic working group on urban WASH, specifically focusing on urban areas, because urban areas seem to have also issues that are peculiar to them that you may not find in the rural setting. And then we have the newly thematic working group on WASH in emergency settlements, WASH in refugees, in the refugee communities, and that specifically addresses issues around WASH in the refugee context. So, for instance, WASH in the refugee context is being led by Water Mission. Urban WASH is led by CD. IWRM is led by Join for Water. WASH Technology is led by Water for People. Good Governance is led by the Uganda Water Project, which we call Red Rhino. Sanitation and Hygiene is led by World Vision. Vulnerable women, children, and other vulnerable groups is led by Arue. So that is the kind of structuring that we have. Of course, on the other side of the regional coordinating structures, we have also the leadership structures. Someone will want to know who is leading us in the mid-central and where is the mid-central. I think the mid-central are those areas around Masakacho, Tera, Rakai, around that area. Then we have the central, which captures the Kampala metropolitan area around Mukono, Luwero. We have the Rwenzoris that stretches all the way from Chegegwa up to the Congo border, up to Hoima. And then West-Nile, that one is already self-explanatory. Choli and Lango region, self-explanatory. Karamoja, Now, they all have leadership structures. The mid-central, for instance, is led by Sidi. Southwestern is led by Chigezi Diocese. Rwenzori is being led by Water for People. Central region is coordinated by Wells of Life. West-Nile is coordinated by Water Mission. Acholi and Lango area is coordinated by AMREF, Health Africa. Karamoja is coordinated by Save the Children. Mid-Eastern region is coordinated by Busoga, Mid-Eastern is coordinated by Yes Busia. And then Busoga Trust is, Busoga region is coordinated by Busoga Trust, while Teso region is being coordinated by Weltunge Health. Those are some of the leaders coordinating those coordinating structures. Now, below the regional coordinating structures, we have the district focal person. So each of the districts that we have, I think they're around 136, they have a focal person who is supposed to spearhead the coordination of those, civil society organizations addressing issues around the environment, WASH in that district, and then that is how the chain grows. Basically, that is to give you a snapshot of what UWASNET is. At the Secretariat, yes, we are led by the Executive Director, Madam Unia Musaz, who should have loved to be here, but we have another engagement happening where she's also, one of the speakers. So that's why she's not able to be here. Otherwise, she should have been able to present this so that you have some information around what UWASNET is. So the kind of work that we do rotates around coordination of the civil society actors, but also the private sector. It looks at how we promote learning amongst, cross-learning amongst the regions, amongst the thematic working groups, but also learning within the sector like we are going to delve into today. The other component that we deal in is to promote partnerships and synergies. And then very lastly is to ensure that we also participate in policy development processes, but also influencing policy at local and national level, at district or at subnational and national level, or even beyond. So that is what UWASNET is. If someone else has a question around it, you will let me know as we move along. I would like to, I don't know whether you're hearing me very well, but my end here.
Loud and clear, sir.
I'm trying to move my presentation. Okay, now I can move. So we are introducing the component of social accountability, specifically using the WASH Scorecard that UWASNET is, trying to promote across. Of course, I'll give you a snapshot about the WASH Scorecards, or the scorecard methodology is not a very new thing here in Uganda or across Africa or across the world at large. Scorecards started being had around the Millennium Development Goals, and of course, we have continued to upscale them. But in our context, we are looking at Uganda, we are looking at the SDGs, and we are looking at different other documents. So Uganda, for instance, has the National Development Plan process coordinated by the National Planning Authority. Apparently, we are implementing the Uganda's National Development Plan 3, which is aiming at increasing awareness, response, and deliveries of WASH services as well. I will not take you through all that is around the planning processes within the country, but to someone out there listening to me, should be able to understand that right now Uganda is implementing a programmatic approach. So we have a number of programs through which our country, is trying to render services to the people. And to be very precise today, I will speak to 2 or 3 different programs where this sector contributes, which this sector which we all in the sector contribute to. First and foremost is the Human Capital Development Program. And this is the program being coordinated by Ministry of Education, of course, with support from Ministry of Water and Environment and Ministry of Health. Those are the members championing or taking leadership of the Human Capital Development Program. And that's where the subcomponent of water, sanitation, and hygiene is embedded within the Human Capital Development Program. But then we have another major program called the Natural Resources Environment, Climate Change, Land and Water Management Program. That directly speaks to the Ministry of Water and Environment. That's why it's being coordinated. And then we have the Agro-Industrialization Program. Agro-Industrialization Program comes in play as we talk about it, simply because there is some bit of synergy that we do. Both water and agriculture happen on land. And then you heard me talk about land and water management, something that program. But also, you will realize that agriculture, to be more meaningful to us, it must have water. And so there is the component of water for agricultural production. Of course, water, as we look at it, it has so many faces: water for industrialization, water for minerals, water for this, water for that. But the three programs within the Uganda's national development programming framework are those that quickly any other member within this sector will speak to. So that's how, in trying to respond or to contribute towards those different programs as a country, it is also not coming from the blue. The programming is also informed by other, different documents that Uganda has, ratified and domesticated. For instance, the Sustainable Development Goals. So when you look at the Sustainable Development Goals, and for someone out there, I would have posed a question if we were in class. I would have asked you how many, Sustainable Development Goals we have. But I will answer that for you quickly, that we have 17 of them. Of course, I will not mention all of them. I will know that there is no poverty, zero hunger, good health, quality education, issues around gender, and then we come to number 6, which is on clean water and sanitation. Now, WASNET sat down and said, achieving universal coverage by 2030 requires, efforts in harnessing social accountability, so as to realize improvements in safely managed drinking water, sanitation, basic hygiene services, as well as, improving the governance structures around clean water and sanitation. WASNET developed, therefore, a scorecard to empower her members, the civil society organization and private sector, so that they're able to monitor, but also report on the National Development Plan 3 indicators. It should be noted that the right to water entitles everyone to have access to sufficient, safe, acceptable, physically accessible, and affordable water for personal and domestic use. So we shall delve into what now the scorecard is about. But before we get into the scorecard, I must remind you that everything that we do or that we talk about when we are addressing the component of social accountability is formed by a legal kind of framework. So I will refer you, for instance, to Chapter 4 of the Ugandan Constitution, Article 38. Chapter 4 is the Bill of Rights, the one that talks about the promotion and protection of human rights. So Article 38, I'm not a lawyer. I don't know whether these are called subsection or clause. I don't know. But allow me for today, call it Article 38, subsection 1. Says every Ugandan citizen has the right to participate in the affairs of government, individually or through his or her representatives in accordance with the law. And 2 of that says every Ugandan has a right to participate in peaceful activities to influence the policies of government through civic organizations. And so at the helm of coordinating the civil society organizations, we are guided by this legal kind of framework in chapter 4, enshrined in chapter 4 of our constitution, and that particular article. Of course, it is not a standalone. That goes hand in hand with other articles within the constitution, such as Article 17 of our Ugandan 1995 constitution, that speaks about the duties of a citizen, what we, the citizens, are mandated to do. So to enjoy these rights, we also have duties at the other end in Article 17. So social accountability rotates around that kind of, we are given that mandate from that kind of perspective. Before we delve into what social accountability is, allow me, now that I've talked about issues around the legal matters, the constitution, remind you that what guides us legally in Uganda within the sector is the Constitution of Uganda. We also have the Water Act, we have the Local Government Act, the National Water and Sewerage Corporation Act, Public Health Act, and National Environment Management Act. There could be many others, but for today, these are the ones I managed to capture. While we have the guiding, policies, policy frameworks, for instance, the National Water Policy, the National Health Policy, the Environment Health Policy, the National Sanitation Guidelines, the Wastewater Discharge Regulations, Integrated Sanitation and Hygiene, Water and Environment Gender Strategy. And then we have other frameworks. For instance, those that I failed to capture because of time, we have the Operation and Maintenance Framework. We have the ODF, Open Defecation Free frameworks. We have the CLTS, the Community-Led Total Sanitation protocols. We have other guidelines like the recently developed the new school toilet designs that were developed by Ministry of Education. So there are so many documents that are meant to guide us in the pursuit of our work. So whoever is serving within the sector really must, accustom themselves to, must get used to reading some of these documents so that we are fully guided. And of course, every financial year, we are guided by a national budget. Of course, we have also the district budgets. So the documents that rotate around there, someone should be able to know that the budget and the NDP III or the National Development Plan are also policy documents. I forgot to put them here. I hope we are not moving at a terrific speed, but allow me to introduce now the component on social accountability. And before I get even into social accountability, I will remind us that the word social was added, but the whole point is around accountability. So this means when you look at accountability, it means being responsible for one's actions and able to give reasons for that action. So in our lives, in our work, we are called upon to be accountable. I know for the Christians, I know for the Muslims, even when we read the Bible, the Quran, it also has facets on, issues around accountability. Many times we are reminded that when we return to the Creator, we shall be accountable for how we used our time here. But before we go there, while on earth, let's try to be accountable in the work that we do. So I will speak around issues of accountability, social accountability in the WASH sector, because I know today I'm speaking to WASH practitioners. So social accountability is a special type of responsibility. It is about a relationship of accountability between the citizens and the government. And it includes a number of actions, which, apart from voting, that citizens can use to hold the state responsible for the delivery of social programs. Now, what is social accountability? And I managed to put something small here. Now, social accountability is a dialogic process between citizens and the power and any power-holding institutions aimed at building participatory democracy, addressing social exclusion, and ensuring effective delivery of services. That is how it is defined by, according to UNDP reports in 2013. So, in a nutshell, it refers to a broad range of actions and mechanisms beyond voting that citizens can use to hold the state to account for the delivery of social programs. Now, I hope there we now get a feel of what social accountability is, a dialogic process. It is not saying that it is a demonstrating process. It is not saying that it is a pick pangers and hose and then go and fight. Key words in there is dialogue. So we must dialogue. Citizens and the power holding institutions. Power holding institutions, these are leaders at every level, from LC1 going forward up to the highest office in the land. Social accountability, like I've said, is an obligation. And responsibility on the part of the government to be answerable to the citizens for its actions. And in this, it ensures that the fulfillment of democratic and human rights principles. So for those of you who may delve into democratic and human rights principles, issues of participation, issues of justice, issues of equity, issues of transparency, rule of law, are some of those are principles that you can talk about, and information access and things like that. It has different actors and factors that facilitate the process of social accountability. So like I've already been talking about, citizens, government, local authorities, but also intermediaries. So where we have the citizens and the local authorities, you can replace the local authorities with government so that we can take stock of all the power holding institutions. And then intermediaries could be those of us, the civil societies, that make the citizens understand their rights, their duties, but also create that kind of dialogic process where government or power holding institutions should be responsive to the needs of the citizens. Those are the three major actors in the process of social accountability. But in all that, the factors that facilitate around social accountability are issues around transparency. Of course, there should be evidence-based, issues, and evidence-based transparency, feedback, and monitoring aspects, and then the participation. Participation has been emphasized. Now, the WASH Scorecard as a form of social accountability. You will let me, give you a background of this WASH Scorecard that WASNET came up with. The WASH Scorecard was built basically to increase awareness of WASH service delivery issues by government, private sector, and service providers, so as to respond and deliver affordable, equitable, and quality WASH services to the poor and excluded groups in the country. It had, had a number of objectives for why that scorecard was built. The scorecard was to establish a shared vision of WASH priorities. The scorecard was developed to help in the prioritizing limited WASH resources so that they are efficiently utilized, but also to advocate for increased donor funding and also to serve as the foundation for WASH planning. The scorecard was also built to help us or guide us reduce on the duplication effort and to identify WASH gaps with greater precision, but also to encourage coordination around the WASH sector issues, and was also built to understand the current WASH conditions. The scorecard we are talking about is hinged on the WASH standards developed by by government of Uganda. We have different WASH standards. I will give you just an example. If a healthcare facility is being set up, one of the things it must have WASH facilities. Okay? So a healthcare facility to be called a healthcare facility must have toilet facilities for both male and female. It must have stations for persons with disabilities. It must have stations for the medical personnel in the healthcare facility. It must have water access points. Those are some of the standards. And in these standards, they even give the ranges of the distances of where the toilet facility should be, how we should actually come up with the water points in the healthcare facility and things like that. Same applies to the schools. And even for the schools, it goes ahead to explain, for instance, how they need to also have the hand washing facilities, same as for healthcare facilities, but how much water learners must be able to take while at school. So issues around access to water, and so many things. When it comes to WASH or water points or water sources in the communities, the standards also indicate the standard of a water source, how it's supposed to look like, how many people it's supposed to serve. Okay? Now, many times these standards are not known to many of us. And so our scorecard is built around all those standards. It's the standards in there that we keep monitoring, that we and the citizens keep monitoring to see whether their water source is up to the standard required by government of Uganda. To go to the schools and find out whether the schools are up to the standard when it comes to water, sanitation, and hygiene. We go to the healthcare facilities to find out if really they are up to the standards established by the government of Uganda. So we are holding government accountable. We are working with government and citizens to hold each other accountable on already the set standards that have been set by or laid out by the government of Uganda. I've talked about issues of duplication, that the scorecard is helping us to reduce on the duplication effort. Why? Because you may find so many entities. For instance, if I may give a case of Luwero, you may find Luwero has a number of civil society organizations working there, doing same activities like government is also planning to do. I was in Luwero just in December last year, and one of our civil society organizations was planning to put up a toilet facility in one of the schools. The beauty is that we are going to conduct a feedback meeting with the local leaders there. So one of the CSOs said after realizing the need of a toilet facility in one of the schools, they have committed to build that toilet facility in that school. At the same time, the district authorities had just concluded their budget conferences, and that need or that challenge had been earmarked by them. So they had also planned for the same toilet facility in that particular school. So this is how now the scorecard brings in the reduction of the duplication effort. We had to agree on who should, of course, the civil society organization was allowed to go ahead with the plans to build a toilet facility. Meanwhile, the government or the local government of the world is going now to transfer those resources to another area where there is need. And that's why we are emphasizing the use of this WASH Scorecard, because it gives timely feedback, understanding of the current WASH conditions with greater precision, and also helping us to utilize efficiently the limited WASH resources. So basically, that is something around the WASH scorecard. As we proceed, social accountability has a number of principles. I already mentioned some of them: involvement and participation of citizens, protection of citizens, citizens' rights to be heard, but also the collective platform and report dissemination. Now, what is the problem we are trying to address? The problem we are trying to address in all this is to strengthen the WASH systems. The WASNET is coming up with this WASH scorecard to, work all around those objectives, specific objectives as I mentioned, but all of them, when put together, you look at the challenges trying to address the issue of the imbalance of the system, and in a way, try to strengthen the system or the WASH systems. Of course, when we are looking at the WASH systems, we are looking at issues around policy and legislation. We're looking at planning. We are looking at institutions coordination, coordinating institutions to understand their roles, their responsibilities. We are looking at the financing. We are looking at the infrastructure. We are looking at regulation and accountability, monitoring, water resources, but also learning and adaptation. These 9 different building blocks are what we call, sums up what we call the WASH system strengthening. So we have since realized that the existing tools used by the WASH CSOs for this purpose were not being fully aligned to the NDP III and SDG relevant indicators, and do not address the human rights-based approach and governance issues. And that's why we feel like the WASH scorecard is the right tool now to employ, especially when it comes to monitoring the WASH indicators set up by the National Development Plan 3, so that we track and see whether all these facets of the 9 building blocks are being strengthened within the sector. Some tools that can be used in social accountability, you can use notice boards, wall paintings, community scorecards. Of course, the WASH scorecard is just one of the tools. Others may use the citizen report cards, the management information systems, participatory budgeting is one of the tools of social accountability, but also the grievance redress mechanisms. These are some of the tools. They are not the only one. There are so many, but these are just some of them. Of course, there are traditional social accountability actions. I will just remind you that the public demonstrations and the protests you see are all forms of social accountability. Though in our case, we emphasize so much of the non-confrontational means of advocacy. You may understand that public demonstrations are allowed by law, especially when you look at the Public Order Management Act. It is the one that guides us on the public demonstrations. And there, the guidelines, you have to inform police, do this. So peaceful demonstrations, peaceful protests are allowed, okay? The community barazas are some of those traditional social accountability mechanisms or avenues where issues are being talked about affecting communities. The advocacy campaigns. Sometimes we have also seen investigative journalism as a tool of social accountability, especially in the health sector. If you remember, there has been lots of investigative journalism trying to look at issues around the drug stockouts, absenteeism of healthcare facilities, health workers and things like that. So it's a tool, or it's an approach that also can be employed anywhere, investigative journalism. Also, in public interest lawsuits, many times you hear litigants or lawyers have gone to court to seek redress of a particular, social issue. So it's also another form of, social accountability. And for the case of UWASNET, taking you back to the WASH scorecard that I talked about, our methodology is just this symbol. It's a participatory approach used throughout the process. So in the whole process of administering the WASH scorecard, we try as much as possible to be participatory at all levels with the citizens, with the local leaders, and everyone concerned, and the CSOs. Of course, we conduct exception meetings. I will refer you to what we've been doing in the last 2 years when we started on this. We have had exception meetings with CSOs, with the local leaders at the different levels, from sub-county level, from community level, sub-county, but also district level and up to parliament and ministry level. So we have also gone ahead to train civil society organizations, the community members, the government officials on how to conduct the WASH scorecard. And of course, from there, we then go ahead to collect the data. And this data is collected digitally using the M-Water platform. The M-Water platform is a platform for WASH that was designed by the Uganda Water Project. So our WASH scorecard is housed in the M-Water platform. And that's how we managed to collect this real-time data digitally, not the use of the paper data collection methods. So after the data has been collected digitally, we then analyze this scorecard. We analyze the data to inform the feedback meetings and action planning for WASH improvement. And after that process, after we have had the feedback meetings and drawn action plans, and then what is left is for the CSOs, the community members, and everyone concerned to, participate in the follow-up activities on the developed action plans. So basically, that is the far we go when it comes to administering the WASH scorecard. 1, it's a participatory. 2, we train, we collect the data digitally. We also analyze the data and then draw action plans. And then, of course, after analyzing the data, we conduct feedback meetings, and then action plans are drawn. And then what is left is to follow up on the commitments made by the different, stakeholders in the process. Do we continue? Or I'm driving you at terrific speed? Yes, let's continue. So how do we go around this WASH scorecard? I have already told you that it has different, indicators embedded within it. And these indicators are as a response to the WASH standards that were developed. I mentioned that. So how do we know that a certain indicator meets the standard? So we have the color codes when we are doing the analysis. We have green, which indicates that the service standard that we are monitoring at that particular time fully meets the service standard on all the indicators. While yellow would mean that it is less. It is above 50% of the above 50% of the indicator for the score category fulfill the standard, while red means that is equivalent to 50% or less than 50% of the indicator underscore fully meets fulfills the service standard. It's either of course, red, it's already danger zone, you can tell. it is either 50% or less of that, means the score or the service standard is not met. It's not, it is actually in an appalling state. While amber means that there was nothing of the standard that we want to, for instance, if we are looking at the toilet facility in a school and there is none, that is where we shall find the color amber, that there is no toilet facility. But if we find that there is a toilet facility, for instance, but the stance pupil ratio is not commensurate, and for instance, there is no hand washing facility, there is no incinerator, there is no changing room for girls for MHM, there is no, a stars catering for the learners with disabilities. That's why you will find, yes, there is the facility there, but does not meet the full, all the standards like I've mentioned them. It will score U50, the red. But if it meets some of them, but not all of them, then it means it will find itself in yellow. And then where all are fully met, that's where you find it scoring green. And like I always tell people in the communities, when we are training the civil society organizations and probably the communities and the local governments, I tell them the scorecard is not a permanent, like the score you have scored today is now long lasting. No, it is just like how we go for HIV testing. They will tell you you're safe for now. So you can still go for to monitor service standards. Yes, you find them in green. Yes, for that time. What is left is for the people around there to maintain that green. Okay? And then when it is yellow, how do we then, the action plans will be, what do we do to make sure that we move from yellow to green? How do we move from red to green? And the actions we draw are around there. So we have majorly been focusing on 4 aspects: WASH institutions, and institutions focusing on schools and healthcare facilities, but also water access or WASH in communities, and then the WASH governance structures. Those are the 4 major aspects that we have been looking at in the current, scorecard. And it cuts across the rural and urban divide. So somehow we've gone to local governments, sub-counties, we have gone to town councils, municipality divisions, and then we're also bringing, last year we did a revision where we are bringing on board indicators that relate to WASH in the emergency areas or in the relief context. So for instance, this is a report I'm going to now be sharing with you for the year 2022. The one of 2023 is still being worked on. 2022 presented itself like this. Of course, you can see that healthcare facilities, all of them performed, or many of them performed, scored yellow. So that was on the service indicators, looking at the water, looking at sanitation, hygiene, waste management, and governance. And when you looked at the WASH in healthcare facilities, for instance, in the 14 districts where we implemented this, we started piloting this in 14 districts. And the 14 districts, we had 5 of them in the central region, 5 of them in West-Nile, and then 2 of them in the Langacholi region, and then 2 of them in the eastern region. So in the West-Nile, for instance, we are looking at Obongi, we are looking at Yumbe, Koboko, Terego, and then Madiokolo district. While in the central region, we are focusing on Luero, Nakaseke, Mukono, Wakiso, and Kampala specifically in Nakawa division. And in the north, in the Acholi area, we are looking at Gulu district and then Noya district, while in the eastern, we focused on Mbale district and Bukedea district. So the results you see here is how they presented district per district when it came to the healthcare facilities in those districts. For instance, you can just look on Kampala, the healthcare facilities, showcased that they were doing very well on water access, while on sanitation, they were not doing very well. Hygiene was okay, waste management was okay in Kampala, and governance was not to the best. Yes, it was above 50, but not 100%. So meaning that some of the indicators or the service standards are not yet fully met when it comes to the governance structures. Either the health unit management committees have since forgotten their roles, or they are not there, or they are no longer having meetings and things like that. When it came to Luero, you can check, that's how it presented. They only managed to get green on waste management. Sanitation presented as a very big red. Mukono also managed to get a green in waste management. The rest were yellow, above 50%, while Nakaseke did not have any green. Hygiene, you can see it was presenting as red, meaning that that's where the major challenge is. While Wakiso also did the same. Koboko, everything was yellow. It is by chance to go back and find that it is still yellow, or something has graduated to green. But it's also possible that you can go there when all the yellows have turned into reds, have gone back. So that's how we read our scores. And Madiokola, I will not mention all of them. District like Terego, you find they only manage the yellow, one yellow on sanitation in the healthcare facilities, while all the rest were red: water access, hygiene, waste management, governance, and things like that. I will not go on, but the general picture, you can find it in the very last column, where the consolidated, aggregate of the scores presented as yellow when all these are summed up together, and then an average got, means with the 14 districts where we did the scorecard in 2022, things are not yet any better. While for sanitation in healthcare facilities, yeah, you can see how they presented, at least many of them on aspects of sanitation, they were doing slightly much better, though with so many reds in Terego, in Yumbe, in Luero, and Mbali. For us, we asked a question, we asked ourselves the question, what does this imply? What does this mean to us? One is that to the government of Uganda, and when I say the government of Uganda, I address it to all the channels right from LC1. The scorecard helps us to get timely information that is critical for planning and decision making. But it's also a periodic and meaningful, it offers information for periodic and meaningful engagements with the citizens, leading the responsiveness to their needs. So when you engage with the locals in the communities, because the locals are the ones who score, the citizens are the ones who score. We don't go to any facility, any school, any healthcare facilities, and we start scoring. No, it is those committees, the governance structures there. The health unit management committee, the school management committee, the water user committee. They are the ones, and the community people, the local council, committee, they are the ones who help us in scoring after taking them through a form of training on how we are supposed to score. So after understanding the standards is when we ask questions, and then we see whether what we are asking is there, or it is in half, or it is completely not there, and then they help us make a decision, agree on the score that we put in the system. So it is not that UWASNET goes with its enumerators and then we start scoring. No, it's the community people who score. So many of these issues, they help us now to have create an interface between the citizens and the government, where the citizens will say, yes, these things we score at them, this is how exactly they add flesh on the scores. To the donor, this gives, the scorecard gives the ability to understand the benefits of investing in WASH systems. So the donor is able to really understand. When you see so many reds, you see justification for why you need to invest your resources. And of course, the scores, as they go changing from red to yellow to green, the donor is able to appreciate the level of effort, the return on investment put into this process. It also gives the ability to appreciate the functionality of the WASH infrastructure. We will understand that WASH infrastructure in Uganda is very expensive. I was told that installing one borehole in Uganda does not go for a cost less than 30 millions. So this brings us to the question of the WASH system strengthening vis-a-vis the WASH system's blindness, where you find in a district, the district local government may plan and invest in, putting across boreholes, maybe 10 of them in a particular financial year, or even more. And then you also find civil society organizations installing many boreholes in the same district. You find a district that has maybe 50 boreholes across the district, only 20 of them are functional. The 30 are dilapidated. Either those who are taking scrap have taken over metals because of the poor, water user committees, the weaknesses in the WASH system, WASH governance structures. No one is there to maintain it. The issues around operation and maintenance are not taken care of. So when you compute the money of the 30 boreholes that are non-functional in a district, you understand the pain of the investors. So you could just imagine 30 millions per borehole times 30 boreholes that are non-functional in a district. How much money is that? That is gone maybe to waste. That's why we are so thankful to government for bringing on board the operation and maintenance framework, which we expect to help us in ensuring that all the WASH infrastructure is very functional in communities for service delivery. So from our implementation of the WASH scorecard, some of the results we can talk about is that one, it has enhanced our evidence generation and learning to inform policy and legal advocacy initiatives. Of course, once we have the evidence, like from, say, a district X, or all these districts I've mentioned, presenting in yellow or red, it gives us a ground, a formidable ground for us to engage with the relevant, policy makers, duty bearers, to either influence them to, have some of these issues embedded within their planning processes, or even within the budget. And it does not have to end there on budgeting. Many things can find themselves in the budgeting processes or in the budgets, but they never find themselves translating into tangible, actions on the ground. So we want to ensure that, one, the issues are heard. We want to ensure that, one, after the issues being heard, they are financed, they are implemented, and then they are monitored. And that way is when we shall realize meaningful, responsiveness from the side of the policy maker, the duty bearers, the government side, to extend services to the people. We're also seeing that service users have known their rights and the different WASH standards for institutions and community water points. Like I've mentioned, is that we take the communities through these standards so that they're able to score them themselves. But in that, they end up realizing and appreciating their rights, the right to participate in these affairs, the right to water, the right to live in a safe and secure environment. Just like I mentioned, there are also alternate duties in Article 17, that the citizens have a duty to pay taxes. That I had to mention. It's a duty of a citizen to pay, every citizen of Uganda, to pay taxes. So for those of us who work, that we also pay the local, I don't know how they call it, the local service tax. Then for you consultants, there is what you call the, I don't know whether income tax or withholding tax. And we are supposed to pay taxes, because if we don't pay these taxes, then we shall keep holding government accountable, and they will be checking their consolidated fund. There is no money to render these services. So as much as possible, let's remind citizens of also their duties as they demand for the enjoyment and protection of their rights. One other thing is that, yes, we have realized that communities are becoming more and more empowered to participate and actively demand for their right to water and sanitation. And then we are increasingly seeing strengthened connections, collaborations across a wide range of CSOs seeking to scale up social accountability in all the project areas I've mentioned, not only in West-Nile, here it's saying West-Nile, but in all the project areas. You will find that this process, because it's being spearheaded by civil society organizations, you will find maybe Red Rhino, Drink Local, Drink Tap, Wave Solutions, coming together in Luero, and many others which are implementing in that area, coming together now to discuss issues around what must we do, because the process is also informing their planning in their respective organizations and their prioritization of their resources. The scorecard has also helped us enhance the evidence generation. Am I repeating myself? Yes. Yeah. Increase awareness of WASH service delivery issues by government to respond and deliver quality WASH services to the poor and excluded groups in the country. But also that evidence and experiences from the project areas have quite often been used to set the pace for discussions at national and international levels and influencing decisions. Of course, once the reports are done, we share them widely, and somehow you find MPs deliberating on them, on some of these issues, because they are informed by evidence, policy makers, district to local governments. So this is helping to set the agenda when it comes to discussions around WASH, especially in the areas where we have so far implemented the scorecard. It has also identified helped us identify key and pertinent issues impacting the effective delivery of WASH climate resilient programs, and these have been amplified. And so far, 3 of those issues have been adopted by the Ministry of Water and Environment, especially during the annual program performance reviews. And the scorecard results have been instrumental in influencing WASH planning at local governments. We have gone to local governments which did not seem to, factor, WASH as one of the issues that really deserve attention. But now you find like they have even increased their budgeting, slots. Maybe if they are giving 5 million in a financial year, now they are going to maybe 30 million. You find now they are being considerate. But also the CSOs are coming into, this scorecard is showcasing to them whether they are really rendering services or not. So somehow it is helping them to, refocus on where they need to invest more of their resources. So, for instance, if I may show you one of the successes I can talk about is, I'll make a case of the organization called Drink Local, Drink Tap in Luero district, which when in the process of administering the WASH scorecard at Insao Primary School in Luero district, they realized that the school did not have any water source, any access to improved water for the learners. So they took it upon themselves and committed to install the borehole. And that is the borehole that you're seeing there that was constructed by one of our CSOs who are implementing the WASH scorecard in Luero. And this day we were taking pictures of this water source. We found that the toilet facility for the boys had also sunk in. And so they also again committed. So you can see the greater precision and understanding of these issues and appreciating them and also helping them to prioritize. I know many of them are doing similar things elsewhere. I have visited areas in Mukono, in the hard to reach areas of Mbata, sub-county, around Kabanga, Health Center 3, Kabanga Primary School, where I found CSOs like Atosi Women's Development Trust doing a lot of rainwater harvesting for schools and ensuring that the learners at least have frequent access to water. But when we interrogate and engage government, from the time we started these processes, you find that the LC5 chairpersons, the CAOs, the district water officers are all engaged in this process and very happy. And this is helping them to really effectively plan and make decisions when it comes to WASH for these areas. And increasingly, the meetings, the coordination meetings with the implementing partners are now being, repurposed, using, if I may use the word, using the findings from these WASH scorecards, because at every feedback meeting, there is an action plan that is drawn between the civil society organizations and local governments. So there are commitments of what the local governments intend to do, what the CSOs intend to do, but also what the community members intend to do over a period of time, in the short term, in the long run, in the medium term. So, friends, having taken you through all that, I think I've spoken so much. Allow me end it there and attend to any clarifications, any questions. Otherwise, I want to thank you so much for giving me this opportunity, for listening to me, and for the Water Resources Institute for really according UWASNET this opportunity to disseminate some of its works, but also to, popularize the WASH scorecard amongst all the stakeholders listening to us today. Thank you very much.
Thank you so much. Thank you so much, James, for that interesting discussion and presentation. I know we already have you have some questions in the chat. Probably you could check and see. We could start from there. But members, in case of any question, kindly raise your hand and you will ask your question to the presenter. Thank you so much.
Well, I'm quickly going through the questions or the chat box to see if there are any questions so that I can, but meanwhile, someone can be taking note of whatever question that may arise as I take care of these ones in the chat. I find many of them so far as introductions. We shall share with the Water Resources Institute. How can you access the scorecard online? Fortunately or unfortunately, someone has to, shall I say, to enroll you? Yes, to enroll you. So you can leave us with your contact so that probably our responsible, officer can enroll you when that time comes and maybe take you through some form of, training. Throw some light. This is someone called Cliff. Kindly throw some light on how an institution can become a WASNET member. What are the requirements and what are the benefits? Oh, wonderful. Yes. Apparently, we hadn't yet opened membership to individual persons, but we allow membership of institutions, especially private sector players and civil society organizations. And yes, The process is just that simple. You get members who are already members of WASNET. You apply. The details are on our website, so you can go to www.uwasnet.org. How to become a member is a question there, and the information is all around there. And then it will also showcase you the benefits that you get when you become a member. I think I've also answered that because of time.
Yes.
We are going.
There is a hand.
Please go right ahead.
Yes, Okumu, please, can you ask your question?
Yes, it's not necessarily a question, but I want to give a vote of thanks to the presenter for the sharing the deep insight and the research which was conducted on the scorecard. I'm Alfred Okumu. I'm working with Laudato Si Center Komboni, Uganda, and some of our focus areas is in environment. So one of the first questions I think is already asked, how can an independent organization be part of the platform, as well maybe some individuals, because as an individual may be interested, and yet the focus areas of the organization doesn't suit into the systematic areas of the UWASNET. So maybe we would also maybe look at how can individuals be part of the platform. Then you'll find that when it comes to the statistics of the sanitation and also the hygiene around the health facility, you'll find that Kampala, or the central part, it has been taking the green lead. So I think as organizations which are working in Kampala already, we are doing a lot, and also we are trying to make the government accountable and different stakeholders, and as well the community, we are making them to be part of these facilities. Not only saying these government facilities are meant for only the poor people, but also we are looking at the hygiene as a safe places for our own our own people, or that just a go-zone area where people just go for because they're in need. So there's no any other excuse they have. So you'll find that this scorecard really it has given an insight, and I think we are picking a leaf, and we shall continue with the sensitization and awareness to ensure that at least our public and the masses benefit from the government facilities. We talked of paying tax. We shall continue, although it's not our focus area, but we at one point you hit in and say, please continue to pay your tax, meet your obligation, as you also demand for services, proper services. Thank you.
All right, thank you, Okumu from Laudato Si. Laudato Si, I know it is a Latin phrase, meaning, what does it mean? Loving or protecting Mother Earth, something like that. Yes, I have
Yes,
mentioned.
just to come in a bit, Laudato Si is a Latin word. It's mean praise be. Laudato Si as well, it is from a book which was written by Pope Francis in the year 2015. So is a Pope's cyclical letter to the world, which says, take care of the Mother Earth. The earth is crying. As Christians, what are we doing to respond to the cry of the earth? So the Komboni missionaries of Uganda decided to create an organization known as Laudato Si, Center Komboni, Uganda. And we are located at Our Lady of Africa, Mbuya, in the Komboni House. And we look forward to become members of WASNET. Thank you.
Thank you so much. I think I haven't yet stopped sharing. My email is there, and our website link is there, so you can directly write to me. For those who want to become members, I will be able to forward your mails to our membership engagement officer, who will subsequently follow you up. That is one, and take you through all that is really, required for you to become a member. Someone called Cliff was asking, how has UWASNET enrolled the scorecard among members? Yes, in all these districts I've mentioned, the 14 of them where we started, we are not working individually, we are working with the CSOs fraternity, and it does not matter whether you're already a registered WASNET member or not, for as long as you are a CSO working within the WASH sector. So we bring you on board and train you, and then give you the tools to go to the community and begin administering. Of course, this scorecard, we are administering it once every year so that we're able to track progress of what we are doing, or how the commitments made by the local leaders are translating into improvements of services to the people. Sekuma, before that, someone had said, is it only for UWASNET members? I think I've also answered that. Simon Peter Sekuma was asking me about the reasons for the scores, the green, the red, the yellow. Yes, and I did mention that it meant, for instance, green meant that the scores were fully, the service standards were fully met. If you go to a healthcare facility, or if you go to a school or a water source in the community, and you find that all the standards that talk about that water source are fully met as indicated in the WASH scorecard, then they have no reason why not to score themselves green. But in case they find that, yes, they are there above 50%, a few of them are still lacking, then they will score themselves a 50 to showcase that there is still room for improvement. Where things are not doing very well, below 50%, many of the things are lacking. Yes, there is a water source, but when you score all the standards, 50% of them are really in a dire need, they will find themselves with the red. And then where there is nothing, you expect the school to be having a water source, water access points for learners, a hand washing facility, and these things are not there, then they are not there, they will score themselves amber. So I think precisely those are some of the reasons. Someone was asking whether CBOs can become UWASNET. Yes, a big yes, 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 yes. CBOs, faith-based organizations, are all eligible to becoming UWASNET members. Then Jimmy from the Uganda Wildlife Authority, I would like to know whether UWASNET normally holds capacity building sessions. Yes, we have what we call the UWASNET Learning Series, monthly webinars. Actually, we've just been having one at the same time. It's just fortunate or unfortunate that these two webinars collided at the same time on the same day. But UWASNET has a monthly, calendar of webinars on different topics with different, speakers, trainers. Beyond those monthly webinars, we also have the learning series in partnership with KAUST. KAUST is a Canadian organization, so they do come here and we hold physical trainings on different, topics. But of course, someone should also be aware that it's not only UWASNET. I know that the Water Resources Institute is also there to offer trainings. I know that this week they've just been conducting a training on some of the WASH sector issues with the young people, with the youth. So these webinars are happening almost everywhere, every month. Is a plan for small center town to have public incinerators cause people usually dump sanitary pads in toilets or rubbish for collection? Maybe I've not understood well the question. Winnie, can you go ahead and voice out your question, please?
Hello?
Please.
I'm inquiring, is there a future plan of like incinerators to be put in the planning system? Because usually the pads are usually dumped in the rubbish and usually on toilets, and sometimes it leads to blockage.
Well, I'll make an attempt.
Is there
but
a future plan? Yes?
I know that within the ODS,
Yes.
within the ODS, they are very good experts on some of these issues who may have to help me answer some of these questions. Like I mentioned, for the schools, for instance, the new toilet designs, I mean, they come with they have a section by generator. So for a toilet facility to be built in a school, it must have a generator on it. Okay.
Yes.
In the healthcare facilities, yes. But for public places like say town councils to have a public incinerator, that may relate that may actually be within the confines of that particular town council. I know that publicly we still have Public Health Act guides on some of these things, but it is still challenging. We still need to have a number of engagements around that area. The standard may be there, the guideline may be there, the policy may be there, but the implementation is still a challenge. We're in a meeting and someone was asking whether anybody had ever seen an incinerator in any hotel. Yet these hotels are engaged every week, week in, week out. And they do not say females come when it is not your days. So where do they throw their incinerators? When they dump them in hotels. So these are issues of public health that all of us must come together and deliberate and find lasting solutions. But I believe that in our audience, we could have other experts who probably could be privy to information around some of the issues you're asking. Thank you.
Yes, Engineer Okinyel, you can come.
Thank you very much, Chair, and thanks to the presenter. Just two quick questions. At the beginning of the presentation, I thought I heard the presenter mention that whereas WASNET has the potential of having up to 250 members, currently there are only 170. I don't know, I didn't get quite the exact figures. My concern or my question would be why? What is the issue? I know you've just responded to the question about individuals being members of WASNET, but how can WASNET up the membership that I thought I had you presented? That's one. Two, on the green rating of Kampala, I don't know how you chose the areas for which you are generating the data. My concern would be, or my interest would be to know the status of the vulnerable persons in that area that you generated results from. The women, the people with disabilities, and the other marginalized groups. Wouldn't it have been much useful to particularly focus your area of focus in terms of generating results to areas that have got an unpleasant picture of the vulnerable groups? Thank you.
Good. Thank you very much, Engineer Chinyai, if I got the name right. And for your wonderful questions, two of them. The first one is on the membership, where I mentioned 200, that the sector has over 250 CSOs, according to the mapping that WASNET conducted or carried out in 2019, and that only around 156 are fully subscribed with WASNET. Yes. You may have to appreciate the fact that there are certain, factors that are limiting some of these to participate. First and foremost, I've said the mapping was done in 2019. This is 2024. But between 2019 to date, there has been a paradigm shift. Remember the COVID came in, and some of the organizations had to, change face. Others closed shop, you see, and others, it's because of the donor landscape, the resource envelope is no longer tenable for them to keep in business. So some of them have ceased, for various reasons, but all it comes to the point of we need to conduct another updated mapping, so to understand whether there are still 250 in the sector or more or even less. You understand? We could be talking of 250 that we found in 2019, when currently those that are saying no, for us we do WASH are only those that have subscribed with us. So it's an issue of conducting another thorough mapping. That is what I can say about question 1. Question 2 on the green areas within Kampala and whether we focused on the status of the vulnerable groups, the women, the youth, the women, the persons with disabilities. Yes. See, with the scorecard, we cannot be certain and say, okay, we are going to, of course, what I never mentioned is that we only focused on government facilities. So whatever we are talking about here, they are government schools, government healthcare facilities, or government, yeah. So there are no private. We never went to Kampala International Hospital, Kampala Hospital, no. But for instance, for Kampala, and I specifically mentioned that we are in Nakawa division. And in Nakawa division, we are looking at the parishes of Utabika, parishes of Banda, parishes, which other parish has gone off my head. So we look at what facilities are existent in those parishes, okay, or in those wards for that matter. So for instance, if I may give you a case of one of the healthcare facilities visited during the process, Utabika Hospital in Kampala. It's a place where you really will expect everything to come as green, okay? But there are certain things where you will find, like maybe the disposal of waste is not up to the standard. Maybe the stance ratios within the healthcare facility is also still limited. But when we look at the average rating, that's why you find the whole, all the areas, all the 14 districts, they rated yellow, which meant that really there is still work to be done in the healthcare facilities. I must tell you that in some of the healthcare facilities in Kampala, there are no, stances meant for persons with disabilities. Yes, I will not mention names. There are no stances. For instance, you cannot distinguish a stance that is meant for health workers and one that is meant for patients. So all these are issues. In many of the schools, you will realize that there are the aspect of stances for instance, persons with disabilities or learners with disabilities, they are not there. Changing rooms for girls during those for the case of the MHM, menstrual hygiene management, they are not there. And even if the school has a stance for persons, learners with disabilities, it is a stance of what kind of standard, okay? And is it taking care of the standard of saying, okay, if a school, because the stance ratio for toilet facilities in schools, according to the standard, is 1 to 40, okay? But you find like many of the schools are having about 40 learners going to 1 stars at a time. For the case of the persons or the learners with disabilities in schools, the standard is 1 stars to 6 learners with disabilities. You understand? So we are expected to see, if a school has more than 6 learners with disabilities, according to the standard, it must actually make provisions for another stars. But this is not the case in many of our schools. So explaining the greens, yes, it was, I must say, random sample, where it is by luck that the selected parish in a sub-county is having a healthcare facility. The selected division in Kampala is having a healthcare facility, And when you go there, but averagely you'll find Kampala, the sanitation, the hygiene, the water is really up to the point. And someone alluded to that there has been a lot of work done within the Kampala area as compared to other remote districts. Thank you, Engineer.
Thank you for your response.
James, there is another question in the chat.
Okay. Oh, how is the scorecard linked to the SDG target reporting? Good question. This is from, well, at the start of my presentation, I did talk about two other documents, the SDGs. I also talked about the National Development Plan 3, okay? And the SDG target reporting of access to water, improved sanitation, issues of, hygiene, sanitation, and governance and financing are all embedded within the WASH scorecard. So when we are, for instance, interrogating the WASH governance structures, we are asking issues around how they prioritize, financing of WASH in those institutions, in the communities. So the rest of the domains are those that are within the SDG targets. So those targets are some of those that we considered when we were developing the WASH scorecard. I think that was the last question that I had to respond to.
Very true, very true, very true, yes. Members, in case of any question, kindly raise your hand. You'll be given an opportunity to ask it. In case you cannot speak, you can type in the chat. James, there is a question probably maybe you must have missed. It was something to do with the districts, where someone was asking why is Mityana not part of, what was the criteria of coming up with the different districts that you showed during the study? And also there was a question on having previously conducted, someone was saying having previously conducted the WASH in HFCs using the WASH Fit tool. Is it the same tool which was adopted for the scorecard?
Okay.
Yes.
Let me attempt to the first one. Why is Mityana? I like the advocacy that it has now, started. Someone wants, why is Mityana not part? Yes, for starters, we'd like to have every district undertake this scorecard. But much of what we are doing is projectized work. So there is a slide that I did not particularly bring to this presentation, which should have indicated who supports us where. I mentioned that we have been in 4 different regions. Of course, if we consider West-Nile as an independent region, the districts that I mentioned in the West-Nile region are supported by a project that we are implementing with support from the Austrian Development Corporation. And those are the districts that we are, implementing that program, social accountability program, where ADA is financing us. So we cannot take the resources of ADA from West-Nile back to Mityana. For now, we shall concentrate there. The beauty is that today we are able to appreciate the learning that is coming from there. Secondly, I mentioned the 5 districts within the central region. They are still under a project, which is actually, it's not even a project, it's a program that is being implemented in East and Southern Africa, in 5 countries of Somalia, in Zambia, Tanzania, Kenya, and then Uganda. Now, for the case of Uganda, We were given 5 districts, and those are the ones that we selected: Luwero, Mukono, Wakiso, Nakaseke, and then Nakawa division. Why? Yes, some of these are, I must say, informed by the Water Atlas. Their ratings in the Water Atlas is what informed the selection of some of these districts. So if your district was doing a little bit much better than those others, then probably it's the reason why it was left out. And those that were doing a little badly, someone will say, hey, even Wakiso. Yes, Wakiso is one of the heavily populous districts we have in Uganda with associated challenges. And so those are some of the reasons, basically. Same as for the east and the north, where I mentioned Noya and Gulu, those we are supported, and Vukede and Mbale, we are supported by GIZ. And we were supported by GIZ in the year 2012, in 2022 rather. So that was one question. The second question was about, Francis, if you just may remind me.
The second question was about someone was saying, having previously conducted the WASH in
Oh, sure.
Yes.
Thank you. Now,
Using the WASH fit tool.
I know that the WASH scorecard was built or was developed in a kind of a participatory approach where the CSOs, the Ministry of Water and the Environment, and the development partners such as GIZ came together to, develop this WASH scorecard. I cannot authoritatively mention that that particular tool that is being talked about was upscaled, but I will say that if it had the WASH standards, then somehow it is upscaled. But I would want to say that it is probably not the one. This is an original scorecard. Thank you.
Thank you so much, James, for attempting all those questions. I call upon all who are interested in asking questions. There's still an opportunity. We still have like close to 17 minutes to end this webinar. This creates an opportunity for us to get more knowledge and also to share with the different participants on the call. You can ask in the chat or you can raise your hand. Someone was asking about the presentations and the recording. What I can say on that, we normally share the recording and also the presentations after the session. So immediately before close of today, we will be sharing the recording and also the presentation. For those who have attended, for those who registered.
Yes, so if there is no more question, one other thing, you may see that picture on my slide is a picture of a WASH district status report. You know that the Ministry of Water and Environment every year comes up with an annual progress performance report for the program that I earlier mentioned, the Natural Resources Environment, Climate Change, Land and Water Management Program. So that big book or that big report of about 300 plus pages is we got concerns from other Ugandans that's huge for them to read. So we decided to come up with an abridged version of a WASH status report. Of course, within that report, it gives out the status of each of the districts, how it's performing when it comes to WASH. So we also come up with some of these report cards to inform our leaders of what is happening or how their districts are standing when it comes to functionality of water sources, or sanitation issues, hygiene, and things like that, so that they can propel and trigger their minds and when they are having discussions around WASH issues, and then, you know, use the national the national figures or the national, you know, scores to able inform them of how they can plan and make wise decisions around WASH issues. Yeah. Francis, from my end, I will stop sharing the presentation, and I really want to say thank you so very much. You can now take us into the next steps.
Thank you so much, James, for such a wonderful presentation once again. On behalf of the Water Resources Institute, the Ministry of Water and Environment, I want to thank UWASNET, and in particular James, for such an interesting presentation, and also for sharing the experience and also the practice as UWASNET they are doing in the sector. I want also to thank the participants for saving time and also to be part of this webinar. For those who are attending for the first time, the Water Resources Institute conducts the monthly webinar on the last Friday of the month. However, last Friday was a public holiday. We didn't manage to have the webinar. So that's why we're having it today on 2nd February. And our next webinar will be this month on the 23rd. That will be the last Friday of the month. So again, communication will be made and also shared widely. What I can say that Water Resources Institute keeps on calling upon partners, individuals who are interested in participating or conducting a webinar, or to express interest through writing to the Institute, and a form will be shared with them such that they can be part of the community for sharing information and also experience with the different stakeholders. That being said, allow me to close the webinar. We meet again on the 23rd of this month. Bye-bye.
Thank you very much to our dear listeners. Thank you so very much for sparing time to be with us. But also, this is just the start of everything. I pray that we continue engaging and engaging and engaging around these issues. Hopefully, that's how we shall then improve and add also a brick on our WASH sector in Uganda. Thank you very much, and God bless you.